All right, welcome back, everyone. This is the Department of Education and Children's Hospital New Orleans Town Hall for COVID-19 guidance during the reopening and staying open process for schools. My name is Kimberly Buckingham, and I'm the manager of the ThriveKids program here at Children's Hospital. And additionally, from Children's Hospital, we have Dr. Leron Finger, who's our physician COVID-19 expert on the line today, as well as our Chief Quality Officer for the organization. He leads our COVID-19 response organization-wide, so we're glad to have him here to answer any medical questions. And from the Department of Education, Office of College and Career Readiness, we have our unwavering partner, Meredith McGovern. So thanks for being on, Meredith. And today marks our 11th session since the start of the pandemic. So we're just so grateful to have everyone's teamwork that's on the line today, as well as the Department of Education to get through this challenging time together. So we're looking forward to it. All right, so we're in a good rhythm with just starting off with our resource review during these town halls, moving into an update on COVID-19 in Louisiana, and then working on our decision tree. We have had some adjustments to the decision tree that we'll talk through today that reflect some CDC guideline changes, and then we'll really open it up as usual for open Q&A. Please just continue to put your questions into the chat, and we'll make sure to incorporate those into our conversation. And let's see, make sure we're good here. Okay, and then just some housekeeping items before we get going. We are going to continue our town halls into January and February. We imagine that everyone will have some questions coming back from the holiday break. So starting on January 13th, we'll kick off a bi-weekly cadence, and those will happen on Wednesdays from 1 to 2. And the registration link is here on the page. We also will be recording and posting as usual. Something that is new, tomorrow evening, that's Thursday, December 10th, we will be hosting parent town halls. And we're excited to be doing this in 2 different sessions. From 5:30 to 6:30 will be for our Spanish-speaking families. And from 6:30 to 7 will be in English and open up to the community. Registration is limited, but we'll be sure to record and post as well. So we're looking forward to supporting some of the challenges that we've heard from schools about communicating guidance to parents. So if any of you have insight on what you think parents would like to hear, or what some of their biggest questions have been, please feel free to send those to thrivekids@lcmchealth.org, and we'll incorporate that into that discussion as well. The Department of Education continues to have resources available to you on their website, and that spans from their guidelines to their dynamic FAQ, and even their email address, LDOE COVID-19 support at la.gov. So continue to submit any questions or concerns to that address. From Children's Hospital side, our hotline also continues to be available 7 days a week. That's 504-837-7760. Many of you are aware of the service it provides with high-level COVID-19 medical guidance, but also 7 days a week we have availability for virtual visits with a physician, return to school screenings, at-home symptom monitoring, and guidance on COVID-19 testing resources in your area. Some wait times have been fluctuating due to the demand in the community, and we appreciate everyone's flexibility as we continue to expand our team to meet that need. So if you have any feedback or further questions on how to access that resource, please feel free to leverage our email address and we'll get back to you. Also worth noting, through that hotline on option 2, you can access 24/7 video visits for a pediatric physician. So families have been really happy to have that resource as they have to pick up somebody that's sick from school and might not have a primary care physician established. And on our website, we continue to offer our downloadable materials, whether that's our decision tree or parent flyers, opportunities to ask questions, and then ways to access our services. So I'll go ahead and transition over to Dr. Finger so he can provide us an update on COVID-19 as it stands today on December 9th, 2020, as well as hit home on what those golden rules are and things to keep in mind as we enter into the holidays.
Sure. Thanks, Kimberly. Hi, Meredith, and welcome back, everyone, with about 10 more days left in this academic semester. I think I'm not going to focus so much on the numbers and percentages across the state, except to say we are in the midst of an increasing slope and upward curve and surge all over the entire state. I can tell you locally in New Orleans, we just went above the 5% positivity for the first time in nearly 9 months. And I'm unclear if we have peaked yet. And I know that it's much higher in different parishes and pockets across the state. So it's real. This was predictable. We saw this begin to happen after Halloween, and we've seen the rates of positivity continue to increase after the Thanksgiving holiday. This is a time for everyone to continue to buckle down and stick to all the things that have worked the previous several months to keep us safe and continue to mitigate spread of disease. I fielded dozens of calls in the last since Thanksgiving about what people can do as we work into the holidays. Can I do X, Y, and Z, party X or singing event Y? And the answer is no. I think expanding what we do on our school campuses and deviating from the rules that we've been able to diligently adhere to for the last 3.5 months, just because it's in close proximity to the winter holidays, we don't get that get out of jail free card. And I know it stinks, I know it's challenging, but it's much easier to err on the side of caution and not deviate from the rules that you guys have really spent a long time operationalizing, which could risk creating an accidental super spreader event if we deviate from those rules for just a brief period of time. And if we remove emotion from the decision-making process, it's actually really easy. Stick to what we've been doing, it works, and ideally we'll get through the next 10 days without a continued increase in cases. The other thing is that as folks go into the, and Dr. Palmisano, I'll get to your question in a minute, I see 2 questions. As we move into the holidays, I think messaging to families, students, and also our team members that this is not a 2 or 3 week bubble where we get to do whatever we want. We do have hope on the horizon with the arrival of a vaccine that's going to start in the state of Louisiana next week. And I anticipate that we'll be in a different place in 4 to 6 months. But we need to encourage people to stick to what they're doing, stay with their nuclear families, and not expand that social bubble outside of that if we want to keep this disease in check as we move to continued mitigation. Those 4 golden rules still are seemingly easy to follow and easy for, my kids in elementary school to remember. Don't go to school if you're sick, and that's if you're a student or a team member. Continue to wash your hands and socially distance, and importantly, continue to wear your mask, as we've discussed, over your nose and your mouth correctly when you're at school. So that's just my sort of opening spiel. I know we're going to have a slide to discuss the new CDC regulations that came out last week and the Louisiana Department of Health adoption of those guidelines as we and sort of help you understand the rationale behind the decision by both the Center for Disease Control as well as the Louisiana Office for Public Health, and what our conversations have been with schools across the state about when and whether they should adopt those. So Kimberly or Meredith, you want to move to the next slide for me? So this is the symptomatic individual decision tree. This has not changed from before. The only wording that I added in that is slightly different is in the bottom left aqua box where it had underneath a positive COVID test. I worded it 10 days since either the first symptom appeared or the date the positive test was administered. Part of the hope is that from the Louisiana Office of Public Health is by offering the opportunity for shortened quarantine periods, we might be testing more asymptomatic individuals, not just students, in that period from 5 to 7 days after their close contact occurs. And we want that isolation to take place if they're asymptomatic to start on the day that that first test is obtained. This is not new information, it's just newly added to this guideline. I want to spend some time on the next page because this is where the changes are reflected. And I'll start, I haven't read Dr. Palmisano or this long question that's there, but I'll explain a little bit of the rationale behind the adoption of these and what it means as we move in towards operationalizing. These are options that local leadership can choose to implement as an opportunity to what we think safely decrease the quarantine period if you've got good buy-in from students, families, and team members to remain vigilant through the entire 14-day period after the close contact. And the reason this was done is what we have found is that many people have not been abiding by the full 14-day quarantine, but that most people are actually paying attention to the isolation period if there is identified a true positive case. So trying to balance individual responsibility to collective state and national public health is trying to find the fine balance of the sweet spot where you'll get people to follow as many rules as you can while still keeping our students and our team members safe. So everyone, if you're identified as a close contact, you enter quarantine. There's an option to get a test between days 5 and 7. What I have recommended to local schools who are choosing to follow this is that trying to get the test done on day 7 would be ideal, but it is allowed as early as day 5. If that test is negative, that individual can return to school after the 7 days in quarantine, but keeping in mind they still need to be symptom-free, and reducing the length of the quarantine period doesn't completely eliminate the risk of that individual developing COVID-19, although by and large we think it's much closer to 0% than it is to 90%. But if that individual develops any symptoms during the 14-day period after the close contact, they should immediately self-isolate and follow the symptomatic decision tree. But we would strongly recommend that that individual gets a COVID-19 test. I will tell you, the vast majority of our classroom close contacts, this would be, I support this. I've talked to public health experts within the state and nationally about this. It makes a ton of sense. Because the vast majority of close contacts who develop COVID disease do so before day 7, and they become symptomatic in that sort of 3 to 5 day period. A subset of people still do develop symptoms afterwards, so we just need to be aware of that. If local test capacity or a family does not want to get tested at day 7, then they remain out, but have the option to return to school after a 10-day quarantine without getting that test, recognizing they still need to be acutely aware for the next 4 days of any symptoms that might develop. If at that day 5 to 7 period someone tests positive, you just follow the symptomatic decision tree, which we just went over. So again, this is an effort to try and identify how we can safely decrease the duration of quarantine from 14 days. And I think the 10 days is a no-brainer. I would err on the side of getting that test as close to 7 days as possible, as opposed to, the first hour of day 5, because it just makes it exponentially more valid. And it really does depend on your school local test capacity. I've talked to several school districts and individual schools from across the state. Some have decided to just stick with our old guideline through the end of this academic term. Some have decided, well, we're going to go with the 10 days, but we don't want to deal with the testing at 5 to 7 days. And some have adopted this. So there is some ability for local leadership to determine how they want to implement this new guideline. I see that there's several questions already, and I'm unclear how, Kimberly, if you can translate.
Sure. Why don't we start with what I think is one of the most pressing questions we've received from schools, and that is how to handle operationally the reality of different individuals having different quarantine periods, and what to do when either students or staff are coming back at different times for maybe the same incident.
Yeah, so I might lean on Meredith about that already. I think that's why some schools have said we're just going to lower from 14 to 10 days, so we don't have some people who are cleared at 7 days and some people who are cleared at 10 days. I think it is an operational challenge. Many schools across the state still have a mixed model where there are some students in the classroom and some students at home doing virtual learning. So if that's already in place, that's what I would recommend. But I think that degree of, so it's one thing to give a guideline, it's another thing to talk about how you make it operationally effective. So I think some schools have just said, we're going to stick to the 10 days because that makes it an easier rule to actually do in real life. Meredith, any comments on that?
Absolutely. I think it would make most sense to be handled on a case-by-case basis and for each school system to do what is probably the safest and most comfortable for the parent and the student. So I don't think there's necessarily an operational guideline that one is better than the other, but just take it as it comes in case to case.
Yeah, I think that's reasonable. And again, I think this is going to be exponentially more important for next academic semester as we get through these next 10 days. Because again, if there's someone positive today, the close contacts are out essentially through the end of the academic semester. Kimberly, I'm trying to maximize my chat so I can see it. I see a long question.
Yeah, so that was what we just discussed really was embodied in that discussion. There's just concern around how, if their school is considering, say, a whole class needed to be sent home, needed to quarantine, and the teacher came back on day 7, but certain children came back on day 10. And then, while there's that gap in between the 7-day and 10-day period, the children are sitting in another classroom. And so she's concerned, he or she is concerned about additional exposure taking place because of that. And as you mentioned, that's just going to be an operational decision the school's going to have to sort through locally.
I think so. And I would say there's not a right or wrong decision. I think, you need to do what makes sense for locally in order to have an effective operational impact. There's a question about how you can tell what COVID test a person has had. So it's intentionally, it's not nebulous, but either a molecular test or an antigen test is acceptable, just not an antibody test, which is something that's indicative of prior infection. So neither the CDC nor the state was specific about the type of test, just not an antibody test.
Dr. Finger, should school nurses or schools be concerned about what type of test they advise someone to actually go out and seek in the community? Or can you just say, get tested, get evaluated by a professional, and they can make that decision?
Yeah, I think I think what schools can advise, again, this is the local test capacity continues to be different across the state, although it's exponentially better now than it was 3 and 6 months ago. If you can get a test with same day or 24-hour turnaround, erring on the side of getting it closer to day 7 is what I would like to ask school nurses to recommend, even though there is an option to get it on day 5, but if that makes sense.
Thank you. And then when staff and students come back on campus or report that they did get a test, is it important to describe what type of test in that documentation or situation?
I think you just need to see whatever you're doing now to communicate effectively with negative tests is what I would continue to do. I don't think there needs to be a binder with loads of negative tests kept on site, but whatever you're doing now to effectively communicate from families that there was a negative test, continue to do that.
Okay, thank you. And there's also another question circling back on the varying quarantine periods that are now available. If a school decides to stay with that gold standard of that 10-day quarantine, how does that need to be reported to the state, or is there any type of additional documentation or reporting that needs to go with making those decisions?
Is the clarifying question, is the question, does each local school need to let Meredith and the State Department of Education know which option they're taking? I would say no. I think we've given you options, and these are options to decrease quarantine less than 14 days and how to do that safely. I do not believe that you have any burden or onus to report vertically which option you are taking. And you guys also might choose to be flexible and adjust this as time goes on. I know that some schools I've talked to just said, we don't want to change anything before the end of this semester. It doesn't make sense. We'll reevaluate it for the next academic term, which starts after New Year's. That's completely appropriate. So I think I appreciate the Department of Education's deference to local leadership and how to help manage and interface with their communities.
Okay, thank you. And then we had another question come in from Lindsay saying, what responsibility would the faculty have to make sure that a student who's returning after a 10-day quarantine would have individually? So would that student be allowed to participate in recess or PE or extracurricular activities when they're returning from quarantine?
Once they return, they can do everything.
Okay, thank you. And then we had some fundamental questions around classroom management come in, or getting back to what we've talked about a lot during the summer, and that's really just around how important ventilation is. So would you say that that is a top priority, high yield measure to take if you can keep a door open or make sure the fan's going or have an HVAC system? What are your thoughts?
I think it's not anything that needs heightened attention now as compared to earlier in the pandemic. That doing any additional changes now is not going to serve necessarily to mitigate disease because of these changes, if that's what the question is asking. I think continuing to have ventilation maximized when appropriate, but without causing our kids to become icicles or kidsicles in a cold classroom as we go into the winter months.
And so as individuals are returning from quarantine into school, those individuals, you said, are able to participate the way every other student or staff member can in their daily activities on school campus. But is there anything that changes in the masks that they wear or any other precautions that they usually have to take when they're still within that 2-week period?
Yeah, so that's a great question and one that I've answered a lot on our hospital campus. And the answer is no, because the expectation is that everyone is adhering to universal masking with those mask breaks, obviously during lunch or high aerobic activity. But these individuals don't need to be, there's no higher level of mask wearing for these individuals. I think the one thing that I've stressed, and this is to medical personnel as well as the lay public, is to continue to be attuned to those last 7 or 4 days of the 14-day period, that if there are any symptoms, be aware of it. What I've also told sort of parent groups and families is, my kids have not done any sleepovers, but for that until you get to 14 days, definitely no sleepovers. It should really be like nothing extra if you can avoid it. If that makes some degree of sense.
Okay, thank you. And can we extend the question I just asked to those who are still in that 90-day non-quarantine period if they did test positive? Where do those cases come into account underneath the new guidelines?
Yeah, so those are follow the same rules, and we intentionally left those off these 2-pagers because we didn't want people over-interpreting that. If someone has had a documented case of COVID-19 within the previous 90 days and they get exposed to someone who has COVID-19, they do not need to enter quarantine. But that's only if they have a documented case of COVID-19 within the previous 90 days.
Do they need an antibody test to prove that?
Ideally, they would have the original test. You don't need an antibody test, but you can't just say, I think I had COVID-19 2 months ago. You need a documented positive COVID-19 test.
Okay, thank you. And while we're on the topic of testing, can we elaborate on how antigen tests are used or not used in the decision-making process for quarantine and coming back to school?
Yeah, so I think we've allowed that. I think there's the 2 broad buckets of tests are molecular tests and antigen tests. There are different types of molecular tests. One of those is PCR. Another one that you might see commonly is NAA. We have allowed in many locations across the state, people are using the antigen test. and the state feels like it's appropriate. I think later on we'll talk more, not necessarily today, I don't think, but talk more about how the Binax test might or might not be implemented with this specific population. We're still working out those details.
Okay, thank you. That was really helpful. I'm going to turn it over to Meredith. I think she's had a few questions come her way, and I also want to give her a moment to expand on the Binax now and anticipate additional questions that are coming through around that.
Yeah, absolutely. Thanks, Kimberly. And as always, we are so grateful for the partnership on our 11th town hall. I think they're so informative, and we do try to encourage our school systems to join them to get answers to questions that they have. I'd like to remind everyone that we have expanded our Binax Now test request survey deadline. It can go through the month of December. So if you are interested in obtaining those tests for your schools, there is a survey link in our newsletter and on all of our office hour slide decks that we hold on Thursday. We have, as of this morning, expanded Binax Now testing to include our early childhood centers. So if any of our early childhood centers are interested in that, they can reach out to LDOE COVID-19 support at la.gov, and we will be happy to point them in the right direction of how to obtain those tests and who to talk to at the Department of Health about how to effectively use them. And I did receive several questions prior to this in our COVID account, and I wanted to take the opportunity to ask Dr. Finger these questions. We will probably ask them again tomorrow on our office hours at 3 o'clock, just in case the person asking the question didn't tune in today. So Dr. Finger, we do have some questions. Will the Department of Health be providing a document or some sort of guidance surrounding daily symptom checks that parents should be doing for students that are quarantined?
You know, I know that that information is available on both the CDC website. We offer that sort of through our remote nurse hotline to do daily symptom checks. I don't know if there's a checklist that the department has published. Kimberly, are you aware of that? I know that there's lots of lists of things that folks can check for. And again, it's a broad constellation of symptoms that I hate to say can be almost anything, but I know that that exists on the CDC website. I just am unclear if it exists on the Department of Health Louisiana website, Meredith.
Okay, yeah, I think that it's out there just in general knowledge, but the question specifically is there a document that parents could reference? But if we don't know of one, we'll see if we can put in a request to get one created.
Yeah, we can get that on the website.
I'll follow up on that as well. Thanks,
Okay.
Meredith, and thank you for whoever submitted that.
And then the other question is surrounding would it be helpful for schools to require their staff members that are quarantined to keep the same type of daily symptom documentation?
You know, if they want to do that internally, I don't think that we need to mandate anything, but making sure that they're aware of what those are so that they can increase, escalate, and get tested if necessary.
Okay, absolutely. We do have a question about what are the ages can we test a child for the Binax Now test? So I know we've discussed this before. Do you mind refreshing our memory, Dr. Finger?
Yeah, I don't think there's a lower limit. And again, once we roll out that, that guidance, it will include it on there. But at this point in time, there's not a lower limit of age on it. And I do see a couple of questions about kids younger than 3rd grade returning to school after the, you know, either 7 or 10-day quarantine period, and what is going to be the requirement for masks. We can discuss that internally about whether or not we need to make an adjustment to that or not. Yeah, so rather than me speaking off the cuff, but it's a great question. I see several folks have sort of asked that same question. I appreciate you guys asking it.
Yeah, Dr. Finger, as a reminder, our BESI requirements are the minimums, so schools are welcome to go above and beyond that while we try to figure out how to address this from a policy issue. So they're more than welcome to make the requirement of masking K through 12 on a local level because it is left up to them to go above the minimum BESI requirements if they'd like.
Thank you, Meredith.
Meredith, is that it for questions on your end?
I do believe so. I was able to consolidate them so that we could spend more time addressing the questions in the chat. But as always, if anybody has any operational questions, you can reach out to our COVID support email. Or tomorrow we will be addressing some of these issues again on our Office of College and Career Readiness office hours at 3 o'clock.
Great. And Meredith, do you anticipate revised guidance coming out from the Department of Education, or would you say this decision tree is probably the best reference point for understanding the difference between the types of quarantine pathways individuals might have to take?
Yeah, absolutely. We will not be producing any documents as of now related to this. We do rely upon Children's Hospital's decision tree, and also the Department of Health has created a memo explaining the email that was sent to superintendents and principals earlier this week, I believe Monday. So that is available in our Strong Start resources in our library, and we've linked to all of it in our FAQ documents. So those are the only things that are addressing quarantine on our end, and that's all we anticipate providing at this time.
Great, thanks for confirming. Okay, Dr. Finger, we've had some more questions come in around how to share information with the school whenever someone has been positive. So apparently there's some community physicians that are advising patients that it's a breach in confidentiality to prove that the test was positive through medical documentation. How would you advise schools navigate that kind of situation when that comes up?
Yeah, I think it's a breach if you do it without parental consent, but I found that almost all parents that we've asked have been willing to share consent, and we make that easy. Here at Children's Hospital, we get that consent on the front end. We call the family, and then with that consent, we notify the school. We do ask that families, parents, and or guardians also notify the school to ensure that there's sort of closed loop communication. But we have not had much reticence from families in willingness to notify the school. If someone is willing to get tested and their child or them are unfortunately positive, we have not had a lot of pushback on that at all. So gaining that verbal consent is easy. I agree with those providers who are saying we can't share it without that consent. I just have not personally run into a lot of those problems.
Is there any type of required documentation across the board that every school should look for whenever they're welcoming somebody back onto campus after quarantine or getting a negative or positive test?
No, we have that self-attestation form that is available, but there's not a required proof of anything that Meredith or the State Office of Public Health is going to track down and say, where's that return to school form? That does not exist. And we're relying on just local leadership, whether it's nurse or principal's office, to identify the day that someone develops symptoms and be able to sort of count out the day for that return, which now can include for someone who has COVID-19 disease or is a close contact.
Okay, thank you. And can we clarify what that self-certification form is really used for? I think some schools are, every school has their own individual policy on what documentation is required. But I think there is some confusion around how to use that self-certification form or guide families on how to use it.
When I talk to families about it, it's just sort of a reminder checklist of, hey, it sort of lays out the guidelines in easy to understand non-medical nomenclature. So, hey, has it been this many days? Have your symptoms improved? That sort of thing. And if you can check all those boxes, then you can go back to school and or work. So that's essentially what it is it translates this algorithm and the recommendations from the state into sort of just an easy to understand checklist.
Great, thank you. And just for everyone's awareness, whenever you go to the Children's Hospital website in the ThriveKids section, we do have our COVID-19 support page where you can download this decision tree. And if you have the electronic version, all of these links on this decision tree are live. So they can take you to where those documents are located on the Department of Health or Department of Education's website. So that return to school self-certification piece, you can click on that. Also on our website, we did just do a Spanish translation of that. We had several we had a lot of feedback around Spanish-speaking families needing a translated version.
Kimberly, I wanted to let you know that the Department of Health is working to update all of their documents to reflect the new quarantine guidance. So if school systems access them and they still say 14 days or they seem off, they are working on that right now to update them. So the self-certification will reflect new changes in language.
That's really helpful, Meredith. Thank you. I think that's important for everyone to keep in mind, that everyone is adjusting a lot of their content to match this new update in the CDC guidelines. So with that point, Dr. Finger, how would you advise schools handle this adjustment in CDC guidelines right before the holidays? Do you think if that this adjustment should take place immediately, or would it be wise to wait until after the winter break? Any thoughts there?
Yeah, again, full deference to local leadership. I think any implementation of a major change like this right before a break is challenging, and we want to minimize incremental changes. So I think the moving from 14 to 10 days is conceptually very easy for me to understand. You decrease that and someone could really get in 4 extra days of school. I understand the challenge with the going from 10 to 7 days with figuring out how to document a negative test, and especially as we don't have test capacity available uniformly across the entire state, that might understandably be a big leap for some school systems to take, and I think that makes sense. I think whatever you choose to do, having complete transparent communication with your team members and the entire school community about the rationale is appropriate. I can tell you, I've talked to schools who, again, have taken all options, and there's been very little pushback from local family communities about why didn't you do this or why didn't you do that. So I think ensuring that transparent communication in an anticipatory fashion will make this a successful transition if you choose to transition from the 14-day quarantine to one of these 2 options.
Thank you. We had a really good question come in that said, given how difficult it is to nail down the very first day of symptoms, is it reasonable to use the first day or the day of receiving a test as the first day of quarantine?
Yeah, I think and it's probably age specific. Obviously, an older kid might be more effective at telling you that first date of symptoms than a first grader potentially. And again, if you use the date of the test, you're erring on the side of caution, for sure. So I think if you can't nail down that first day of symptoms with a positive test, then sure, I think that's completely appropriate.
Great, thank you. And going back to testing, I know this is a tricky question, but what are your thoughts on how far away is just, as a state we are away from being able to do some of the precautionary testing or routine testing? And if you could explain kind of what the variables are that go into that and why that's not something that's just, has been available maybe from April.
I guess clarifying question, what do we mean by precautionary or routine testing, Kimberly?
I mean, just setting up designated times of the month for everybody to just go get tested, regardless of whether you're a close contact or symptomatic.
You mean just widespread testing of asymptomatic people, testing an entire school?
Correct, yeah. Better phrasing, yes.
Okay, so thus far, without having a plethora of point of care tests that will give you an answer within the next 15 or 30 minutes, it's an incredibly labor-intensive endeavor. It diverts resources away from people who are clinically symptomatic, many of whom at this point in time are requiring hospitalization. And although it might help mitigate spread, right now, if everyone follows those 4 golden rules, that'll be exponentially more powerful than doing that widespread testing in the case of still somewhat constrained resources.
That's helpful, thank you. And it's always helpful to understand the why behind certain challenging situations. So thank you. Okay, so getting back to a situational question, say an entire class is quarantined, should siblings of students in that class that has to be quarantined also quarantine?
Great question. And the answer is no. There's no 2 degrees of separation. What I would advise is that if a fifth grader who's home on quarantine at any point during that quarantine period develops symptoms, I would hold the sibling home while that fifth grader gets tested. You would not want to unintentionally send someone who might become a close contact in. But from the beginning of quarantine, the answer is no. You don't have to quarantine the entire family.
Okay, great, thank you. And as far as the upcoming holiday season at the end of the year and New Year's, say anybody in their immediate family unit does get COVID and they test positive for COVID-19, do they need to inform schools during that period? And if not, what would be the best way to talk about it when they come back?
So I think the most important thing will be if they develop symptoms or get diagnosed within sort of the 2-day period after school ends, because then there's the potential that there might be some lingering close contacts from the last day of school. I think that's the most important part in order to have closed loop communication with the school. I don't know, actually, maybe I can ask Meredith to comment on what the requirements are over the holiday when there's not sort of in-school exposure risk. Meredith, any thoughts on how you guys want to handle that?
We have not issued any guidance surrounding that. I think your recommendation of if it's immediately after school lets out would be the most prudent thing to do. But if we're, 5 to 7 days into the holiday break, they're really not surrounded by anybody in a classroom setting. So I wouldn't see that there would be a reason on an operational level for us to track that.
Thanks, Meredith. It's helpful to understand 2 days even after ending school, though, for the holiday, to be mindful.
I do see a question from Tony about if there's a close contact group who's out right now on close contact, and the initial plan was to quarantine them for 14 days, then I think, yes, you can modify the number of days that those individuals need to be on quarantine and choose one of the options to decrease the duration of quarantine as we previously described.
Okay, thank you. And we have a lengthier question that came in from Jewel. I'm going to digest that and make sure that we understand how to answer that. There still seems to be some confusion around whether masks are required for the 7 and 10-day quarantine option. Dr. Finger, masks are required across the board, correct?
Well, masks are required for third graders and above. And I think the specific question that Jewel and Ginger and someone else asked was, what do you do with a first grader who's returning at day 11? My bias is that first grader should do what everyone else in the class is doing. But again, I'm asking for just let me sit back and think so I don't answer flippantly without thinking about how that looks and how that works best.
And this decision tree that we have pulled up on the screen right now for close contacts, this isn't different for anybody that can't wear a mask because of a disability, correct?
That's correct. And that's a decision that you can make locally for sure.
Okay, and we have a clarifying question that came in, Dr. Finger. The scenario we just assessed around whether a whole class had to quarantine and then there's a sibling outside of that class, what should you do? The follow-up question is around whether if the class-wide quarantine student begins to have symptoms, do the siblings also need to be kept home?
I know you think that was clear, but I'm still not following you, Kimberly. I'm sorry.
Sorry, I don't think it was clear actually, so I'll agree with you. I'm sorry, Eddie, I might need to come back to that. It seems like I thought Dr. Finger's answer addressed both scenarios you're describing, so I'll follow up with you.
So is this from Eddie? If the class-wide quarantine student begins to be symptomatic and siblings are kept home also, do the siblings quarantine for all required test days if no test is taken? I think in that case, you follow the symptomatic decision tree chart, right? The symptomatic sibling has 48 hours to either be provided an alternate diagnosis or get a COVID-19 test. And if they can't get that answered within 48 hours, then we treat that individual as a presumed positive. So potentially they could quarantine, but ideally that symptomatic student who was a close contact can get a test done and answer the question. I think that's Eddie's question, but I'm not 100% sure. I hope I got directionally close with that, Eddie.
I feel more confident in your interpretation than mine. So thank you for getting through that. All right, and then we had a nurse actually reach out to us earlier today, which I thought was a good question, because this comes down to the difficulty between determining the difference between an ongoing chronic condition and receiving an alternative diagnosis so that you can come back on campus. And the specific situation involved a student who has seen a behavioral health professional and understands that their anxiety manifests through stomach aches and headaches at times, and had episodes twice at the beginning of the year with these anxious symptoms, and was able to go get a test, and the test was negative each time. The third time the symptoms presented, the school nurse wanted to be able to say, we don't need to get this child tested again. Can we use the previous diagnosis and physician's support to be able to say that this is a determined alternative diagnosis and this person doesn't have to quarantine?
Absolutely, but I would remove some of that. I don't think the school nurse has to make that decision in isolation. They can do that in conjunction with the individual student's primary care provider. But I think that's a great example of how important it is to have local knowledge of the situation. That being said, you know, I've seen lots of kids who have seasonal allergies get mild runny noses and end up having COVID-19, where they were treated by their family just said it's just allergies. So it certainly is a disease that can present with common things, even if you have something else going on.
And Donald had a question around whether there's any data for those who have already contracted COVID-19 about reinfection rates or likelihood to get the virus again. Have we made any progress in our understanding around that?
A little bit. It seems like reinfection can occur, but it's exponentially rare to this point in time, Donald. And it's complicated by the fact that we know that the virus particles linger in your nose for days to weeks after your infection is completed. So some of the folks who have gotten tested 2 months after their initial infection, we don't actually think is a reinfection, but just residual virus particle from the original infection. That's a long way to say we don't really know. And to be more explicit, when the vaccine is available, we are going to offer it to people who have indeed had documented COVID-19 disease in the past, because we're unclear what degree of immunity that disease actually confers upon each individual.
Thank you. All right, everyone, we're getting to our last 10 minutes until we have to stop. So I would just encourage you to continue to get your questions in. We're starting to get to the bottom of the chat, so I'll give you all a moment to get those in.
If I can take a minute, Kimberly and Meredith, to give some silver news. I think the state has managed this incredibly well, and I think it's due to leaders in local schools and school districts like you guys on this phone. As I've told Dr. Brumley, I think the schools are the safest place for my kids to be in this past academic semester, and it's due to all the hard work that you guys have done. I feel completely confident having my 3 girls go to their local school because I know that operationally the rules work. I can't tell you how excited I am about the incoming vaccine as a medical professional. Its data is unbelievable for how efficacious it is. And I think that in 6 months, we'll be having a different conversation for where we are. I'm thrilled that educators are at the high end of the tiering list for the state of Louisiana. You're not first, but you're not last. And it's really a recognition about how important it is to keep you and your families healthy through this time. I hope that I have an opportunity to continue to speak about how much this vaccine is going to help mitigate the continued spread of this disease. I know there's anxiety about it. Louisiana is due to get its first shipment next week, and will go out to the Tier 1A groups, which includes hospitals and congregant living situations for elderly. And I can't tell you how excited I am. It really is sort of the silver lining on what's been an incredibly challenging year. And I'm going to be excited to continue to help educate you as you educate your team members when that vaccine is available to the educator teams. So sorry for that plug, but it really is great news.
Thank you for sharing that. That is positive and uplifting. And Meredith, thank you so much to your team. I think we've been able to accomplish a lot during our town halls, so that's exciting. Dr. Finger, is there anything else you think that schools and families should keep in mind throughout the holidays and as they enter into early January, other than to stay positive and keep that silver lining in mind?
No, I know there was one question that was probably from someone locally about testing people after the holidays. Maybe you could reach out to Kimberly specifically to ask that. I think operationally we can do that for a finite number of people. Probably can't do it for 750 people. And also recognizing what the goal is for that. We don't want to keep people out while those test results are pending. So we can discuss that offline. But no, nothing else, but just really very impressive academic term since we returned in August. It's the culmination of many months of work, and just very proud to be a part of it.
All right, Meredith, is there anything on your end you'd like to share before we sign off for the day?
Just a reminder that we will have office hours tomorrow at 3 p.m. To address the operational aspects of this and some other updated information that we have available for our schools. And as a reminder to everyone to continue wearing their mask beyond the school bell, because they do, the community does look to our educators to set the standard and be an example. So I think everybody's doing a great job with that.
Great. Well, thank you. Thank you so much, everyone. We'll go ahead and call it for today. We're going to post this online. And I would just encourage everyone to look at Children's Hospital New Orleans Facebook. And on our website, we do have our parent town hall information posted. So be excited to have a discussion tomorrow evening as well. Thanks, Meredith. Thanks, everyone.